Good afternoon, everyone. Please, someone confirm you can hear me. By maybe a thumbs up. Perfect. So we'll start the session. Today is on Friday. I know the priorities have changed, so we're going to try and be as brief as possible. For this session, we're going to cover MCH the way we did in the morning. So I'll request Evelyn to share her screen. County, just do a thumbs up. Anyone joining from Kilifi? Anyone from Homa Bay? Anyone from Siaya? You can see Homa Bay. Anyone from Siaya? Okay. I've seen William has raised his hand. Anyone from Kisumu? Thanks, Tony. I can see a couple of hands from Kisumu. So welcome to this training. It's just a continuation of the series we've been having this week. So Evelyn, please share your screen. So as Evelyn shares her screen, I'm just going to talk through the prerequisites for claims integration in the EMR. So as we already know, the DHA has given a go-ahead for facilities to use Kenya EMR for claims. So that means that by Monday, all the provider portals will be shut down and you'll be required to claim from the EMR. Now, for you to be able to claim from the EMR, all these 4 counties currently, their data are hosted on cloud. The facilities are also hosted on cloud. So the partners will support in upgrading the facilities over the weekend. So on Monday, when you go to the facilities, you need to reconfirm your. Sorry about that. So you need to reconfirm that all your chargeable items are in place and they are correctly captured in the system. Also, you need to confirm that all the healthcare providers within the facility have also been validated. Their licenses have been validated in the system correctly, and they are able to perform claims. Again, we know that if a provider who is not validated tries to submit claims, then the claim will be rejected. And same case for line items that don't have prices, if they are ordered for patients, if you submit the claims, it will be rejected. So those are some of the key requirements. Also, you need to make sure that your facility has biometric scanners. So currently we're working with Safaricom to do a training to the technical teams to ensure that facilities are able to connect to the biometric scanners. So Evelyn, maybe you can share your screen. Yes. So for this training, we've been concentrating on level 2s and 3s. That is for PHC, because the rollout is starting with the level 2s and 3s. So for the workflow for today, we're going to look at maternity, PHC. Yes, so we will use an existing patient. So as I mentioned, when you log into Kenya EMR, the first thing you want to do is to ensure that your chargeable items are configured correctly. So we've gone through this process since Monday. So I'll just show you where to do it, but you're not going to do it for this session. So you'll navigate to the 9 dots. So you'll click on the 9 dots. Evelyn, please click on the 9 dots. So you'll click on the 9 dots, then you click on billing admin. For you to perform this operation, you need to be using the admin account. So when you click on billing admin, then you should be able to see on your far left clinical charges. So when you click on clinical charges, then you should be able to see the existing clinical charges in the facility available there. But then again, for you to be able to add, because you'll need to add this for all services being offered at the facility, and also for all commodities that you have in the facility, you'll need to click on the action. Besides the action, there's a down arrow. So when you click on it, the first thing you'll see is clinical. Just click on the down arrow. Yes, so for any service that is being offered in the facility, you'll use the add charge service. For any commodity that is being offered, you'll click add charge items. As we speak right now, it's still not possible in the system to bulk upload the items. So you'll restrict your billable items to just adding them one by one. Either services use add charge service, or commodities you'll use add charge items. To validate your providers in the facility, you'll need to click on the 9 dots still. Click on the 9 dots. Evelyn, click on the 9 dots. Yes, and then you navigate to the administration. Click on administration. Okay, so in the administration, when you open it, it will first of all bring you the manage users tab. So you'll search for existing users, you'll search for them. We can take an example of the user called Amanda. So you'll click on Amanda. There's a down arrow besides Amanda's name on your left. So you'll click on the user. Once you expand, then on your far right, we have the actions. So you can be able to click on the options. You'll be able to see edit user. So you'll click on edit user. So when you click edit user, it will open for you the user's profile. So when it opens for you the user's profile, the most important tab here is the provider account. So you'll click on provider account. On your left, there is demographics, login info, and then provider accounts. So Evelyn, you can click on your left, there's provider account, and then we have the place where there's national ID. So you'll input the national ID for the provider. So currently we're only able to validate providers who are registered with KMPDU, who are registered with the Nursing Council, clinicians, and also the laboratory and the farm tech. So those are the ones we are able to validate. So you'll put the provider's national ID there. We are not going to put for now, but you'll put the ID. Then you'll scroll down to next and ensure you save. So when you scroll down and you click next, it may not allow you to click next. Okay. So you can now proceed to save as the facility. Then so once you save, and then Evelyn, just cancel because you're not going to save, so you can close up there. So once you save the details of the patient, so just close to your far right, and then you'll go back to the patient details just the same way we clicked on the three dots, and then you should be able to see sync. So just click on the three dots again on your right. For any of those patients that you're displaying, just click. There's the action button on your right. Yes, so you click on it, then the sync button will be active, and then you click sync, and then the information will sync. Once the information syncs, I believe we can see the provider called Brian Wamadai Kamara. Whatever information will now be pulled will be like what is being displayed for Brian. You'll be able to see the license number, the provider unique identifier, and the date that the license is expiring. So if you do those two key things, then your facility should now be ready to start using the multi-claim. So now we're going to go into the maternity workflow. So I'll start off and then I'll hand over to Evelyn. So like we've seen from Monday, the first step is of course to pull information of the patient from the national HIE. So we're going to pull the information of the patient that we're going to use for this demo. So Evelyn will put the ID number. So once you put the details, and then of course the details will be pulled. So once it pulls, then the system will request you to send an OTP. So we'll send OTP. So this OTP is for the mother to consent for us to access the information. And then when the OTP comes, Evelyn will key in the OTP. Okay, then the next thing, the system will request you to now check in for you now to start accessing forms and give service to the mother. So we'll click check in. So it is at this point where we start to queue the patient to the system. It is also at this point where we start to bill the patient. So the billing process and the queuing process starts from here. So we'll select that we are checking in the mother for inpatient. We're assuming the mother has come to the facility to give birth. The mother has gone directly to maternity. So we'll say the mother has come in for inpatient because at some point we're going to also admit the mother first in labor and delivery ward before we're able to offer services for maternity. So we'll check in with inpatient and then we'll select the triage room. Maybe you can scroll your screen, scroll down. So at this point, you can just select maybe triage room OPD. But at the facility level, you'll be able to configure this to align with what you currently have in your facility. You can even pick triage room 2 MCH. Either is okay. But at the facility, we know that when a mother goes directly to maternity, then they're not tried. They're basically, they get in, they are put somewhere for bed, they are being done for examinations before they are admitted. And then we move to the mode of payment. We say this mother is not exempted from payment, so we'll say no. So we'll say the mother is not exempted from payment. So select no, Evelyn.
I have selected Frida. Maybe
Okay.
okay.
It's a lag from my side. Thanks. Then we'll select the payment method. So we'll click on the payment method and we say insurance. Remember, we are showing the workflow for SHA. And then we'll proceed to select the scheme. So we'll say the insurance scheme is SHA. As we speak right now, we are still not integrated with other insurance policies. So this may not work for other insurance policies. And then the system will ask you if this is an elective visit. So we'll say no. But if it is an elective visit at this point, you can also say yes, because this is maternity. This is only, it's not applicable if it's OPD, but if it's inpatient, it can either be elective or not. Then we'll proceed to the package. So we'll click on the package and we'll choose the maternity package. So we'll select the maternity, neonatal, and child health services package. Then we'll proceed and select intervention. So it will depend on whether the mother has come for cesarean section or vaginal delivery. So Evelyn, you can choose either. Okay. And then it will even tell you whether pre-auth is needed or not. And then we proceed to now select the chargeable service for this. So do we have any chargeable item for maternity? Let's search. Okay, that's fine. Okay, so you'll again, this is why it's very important for you to add your chargeable services, so that at this point when the mother gets to the facility, at the facility level, you know the first payment they're supposed to make is for what exactly. So you'll be able to add the chargeable service there, and then you proceed and you save the form. So the moment you say you're starting a visit, then the system will ask you to authenticate the patient. So you can authenticate the patient either via biometrics or OTP. As we speak right now, most facilities are using biometrics. So you'll be required, that is the required way of authenticating patients. But you also know there's some patients who they have issues with their fingerprints. And also maybe your facility, the biometrics would have been damaged or something like that. So for such kind of cases, you'll use OTP. Because our test instance is not connected to biometrics, we're going to go with the OTP way. So Evelyn will click on use OTP. Then you send OTP code. If you say you send OTP, once we start rolling this out, please remember that at the facility level as well, there will be an extra question on you to validate why you're using the OTP. So you'll be requested to also input all those results there. So that will come with the version we're expecting on Monday. So Evelyn will key in the OTP. Okay. I think that's fine. So Evelyn, you can just search for the name of the patient up there. Okay, that's fine. That's fine. Okay. So our patient has been checked in, and now we are ready to provide services. So in the EMR, for you to provide services to a mother in maternity, they first need to be admitted in the maternity ward or labor and delivery. So the other thing that I didn't mention is for labor and delivery ward in the system, you have to also um, uh, tag it appropriately. So hopefully before we are done, once you're done with the session, we'll also take you through how to tag location so that you see if you don't tag the location maternity or if you're calling it labor and delivery ward in the facility, then you'll not be able to see things like photograph. All right, so for us to admit these patients, we'll navigate to the patient profile the way we are seeing. We'll click in patients. And then we have the first tab written admission requests. We'll select record admission request. And then we'll proceed to say admit the patient to the hospital. And then we select where we want to admit the patient. So we're admitting the patient in labor ward. And then we save and close. So what we have done is we have requested for the patient to be admitted. So you're going to now proceed to the wards now to have the patient actually admitted in the labor ward. So at the facility, you'll click on TaifaCare and then you navigate to admissions tab, which is on your right. Again, we are using an admin account. That is why we're able to do all this. But at the facility level, we know the person doing the admission request may be a nurse who is seated at the reception. And then we also have another department where now mothers will be admitted at the facility. So it may be one or two people doing this, whatever we are currently doing within one account. So when you go to admissions, then you're going to switch the wards so that you are able to see labor ward. So when we go to labor ward, you can see under awaiting admission, we have our mother, Evelyn, who is waiting to be admitted. You can see their gender, their age, and the duration they've been in the ward, which is 0, because we still haven't admitted Evelyn in the ward. So on your far right, under action tab, we have the 3 dots. So when you click on the 3 dots, we have 3 options. You can either admit this mother to a different ward, or you can admit them to that ward, or you can cancel the admission request. So for this case, we're going to say admit patient. All right, so when now it will open for us the admit patient form. So we're going to start by putting in the diagnosis or the major complaint. So our mother is pregnant. So let's Evelyn type the major complaint. Okay. And then you'll select the primary doctor. So the doctor must be an existing user within the facility. So you can select any Evelyn. And then you can type the primary doctor's phone number if they are willing to provide. If not, it's not a mandatory field, then you can move to emergency doctor. Again, it's not a mandatory field, but if the patient has an emergency doctor, you can put same case with the phone number. Then you go to the payment mode. At this point, we are selecting insurance. And then we are selecting the insurance type, which is SHA. And then the most important thing when you're admitting a patient is bed management. So at this point, you get to allocate the patient to a bed. So if you don't select a bed, then your patient will be admitted, but you'll not be able to see your patient in the ward. So you'll have to go and delete that the admission form that you fill, and then you come and admit again. So select a bed, then you set.
Rita, if you're talking, I can't hear you.
Give me a minute. Apologies for that. So the moment you admit your patient, then your patient moves from awaiting admission to admitted. So if you click admitted now, we should be able to see our patient Evelyn. So Evelyn, just remove the filter. Just remove the filter, Evelyn. There's a filter. You type Evelyn in the search. No, down here in the search button, search box. Hapo kwa word patients. Yes, you type your name. You search to yourself. You can see where you wrote your name. Yes, just remove it. Yes, so if you don't put the bed number, then this is what you have. You have patients who appear as being admitted, but then will not have the admission dates, and then also the bed number will be 0, and then you'll not be able to do anything to this patient in the inpatient. Okay, so we'll proceed with our patient is linked. So we'll select his link. Okay, it will return us back to the profile of the patient. Then we'll click in patient. Okay, and then now we'll proceed to now offer maternity services. So I believe in the maternity, you also need to pick the vital signs. As you can see, our patient doesn't have vital signs because we didn't fill in the charge form. So we have the record vitals there. So you will also be in a position to record the vitals. So we can quickly record the vitals. So we are saying the patient has a complaint today. So yes, you can put the presenting complaint, then duration, and then onset status. Then we can say having physically examined the patient came in walking. The patient has not had an injury in the past 48 hours and they are alert. And then we can proceed to now pick the vital signs. So Evelyn will pick the vital signs. Again, remember we've incorporated alerts. There's an algorithm that is able to tell you whether the vital signs are critically high or low in the range as we continue typing. So that is also there currently in the version you'll be getting. Okay. And then we'll also pick the anthropometric. Okay, they will also calculate the BMI, also the nutritional status, and then you'll put the LNP. Again, if they give you the information, which is key in our case because the mother is pregnant. Okay, and then with the information is collected, the child will give us a score. So the mother is not an emergency client. Then we'll proceed down. If we have any notes, the maternity then document. If not, we'll proceed to save and close. But again, you can take notes. Okay, so now when you in the profile of the mother, as you are now filling the other form, you can also be able to see the vitals, and you can see the ones that are very critically high, like the BP. You can see the alert, and it's color coded, and it's showing you the arrow. And you can see the rest as well. You can also see the date when these vitals were collected. You can see these also collected today at 14:40. So I know in the maternity mothers are monitored, I think hourly or something like that. So you can always monitor the time when the vitals were collected. Now for maternity, the first thing we'll fill is the labor care guide. As per the guidelines, the current deadline. So Evelyn will proceed and open the maternity orientation form for labor care guide. So we'll just take you through the form, but you're not really going to fill the form. So the labor care guide is exactly as what you currently have according to the MOH guidelines on the ground. So we've just digitized the form in the EMR. So we'll have the maternity details. We'll have the medical history cards that are relatively filled as we move along. Okay. So you'll capture the LMP, you'll also calculate the EDD, and then the gestation. And then we have the medical history, where you'll put the history of blood transfusion and the family history. Then we have the obstetric history. So you'll be able to add a number of antenatal controls, then place of childbirth, and the gestational age of mother. Then you'll proceed to also do the duration of labor, then method of delivery, pathway. Okay. So let's Evelyn proceed from here. So she'll complete the care guide, and then she'll also navigate to show the inpatient form and also part of the service form. So over to you, Evelyn. Evelyn, if you're speaking, you're mute.
So first thing first, I need to fill in the form, that is the maternity inpatient form. So allow me to fill it very fast for it to open the labor care guide. Sorry for that. Then we can do obstetric history, but just allow me to skip and do the mandatory ones. But at the facility, you can be able to do the necessary history checking and also the examination for the mother before you start the labor care guide. So admission, you say it's yes. The fantasy, it's 39, it's cephalic. Then it's anterior, the fetal heart rate is 140. Allow me just to skip the others. So then from there, we have the labor care guide. This is our labor care guide. You can be able to see the name of the patient, the age, the parity that we have already filled from the maternity inpatient, the labor onset that we need to fill that. We also have the ruptured membrane, the risk factors, and also the date of the diagnosis, the graph that's already been filled in. Then you can be able to see the parameters that you are able to monitor. We have the supportive care, the baby, the mother, then the labor progress, which has the cervical dilatation, the descent. Then we have the medication, if oxytocin was given, the the other medication and the IV fluid. Then we have the shared decision making. So then up here, we also have an alert sound, which is on. This will alert you if maybe you have an alert and you have not actioned on it. So you need to action on it for you to be able now, like for it to go off. So then let's start by filling in. Then we have the labor onset here. So is it a spontaneous, induction, pre-labor? CS, let's say this is a spontaneous one. The date of diagnosis, it is today. If the mother has any risk factors, we have the chronic hypertension, colonization, multiple gestation, and none or other. They say there's none here. Let me just take chronic hypertension for us to be able to appreciate the alerts. Then we have the ruptured membrane. If it was ruptured, we say yes. And if it was yes, you can be able to key in the date it ruptured and also the hour. Let's say it was 11 today, and then you save. So you can be able to see here the risk factors, the ruptured membrane, it has filled in, and then the risk factor, it has highlighted red. Then from there, we start with the filling in. We are filling in right now. Then we start now monitoring this mother. So we have the time and the minutes for this. So we have the companion. Is it a yes, no, or declined? Let's say maybe it is a no. The pain relief, let me say it's yes. The oral fluids, let me say it's no. The mother is not taking the oral fluids, or she has not been given. The posture, is it supine or mobile? Mobile, you can, the mother can be maybe in a mangi style or something else, so long as it's not spine. So if you key in, let me say it's spine, then you save. You can be able to see the alerts being circled in red. And here we have the alerts which tells you that if it's a no, which is being marked as an N, it's an alert. So then we move to the baby. Same thing, we have the time and the hour. So we do the fetal heart rate. Then we say it's late. Amniotic fluid, it's clear. Fetal position, it's anterior. The caput is +1. Molding, let me say it is 3. Then let's say save. Then here also you can be able to see that it has plotted and also given you the alerts. So let me go to the mother. Let me say the pulse, maybe it is 98. Systolic is 128. Diastolic, let me say it's 80. Temperature is 36.7. The protein, let's say it's nil. And also the acetone is nil. Then we save and close. So from there, we go also to the labor progress where we have the contractions. You can be able to see here you have been given what are the alerts. So let's say the contractions, they are maybe 6. Duration 40 seconds per minute, lasting for 40 seconds. The dilatation, so because we don't need to go like the whole process and waiting for maybe 4 hours and the hours that are needed to monitor for each parameter, just allow me to say this is cervical dilatation is 10 so that we can be able to move and deliver this mother. So 10, after you have said that, you have also another parameter here you need to say urge to push. So you say yes, the mother has a urge to push, and this descent right now, maybe it is 0, then we save. Then you can be able to see like from here, it has closed. When the mother has reached 10 centimeter dilated, the cervix is 10 centimeter dilated, it closes the first stage and moves you to the second stage. So then just allow me to come here and do some medication in the second stage. Let me say it's now. Medication it was given. The drug name, maybe it was paracetamol. $500. So this checks the stock to see if the drug is available or out of stock. This means that the drug is available in the stock. Maybe you're giving 2 tablets, giving orally, and maybe now you're giving 2. Then if there's any drug, you can be able to add and continue. Then we have the fluids. If you're giving any fluid, you just say yes. And then you choose the fluid that you are giving. Maybe it's normal saline, then you save. So after doing that, you need to do your assessment and the plan and the action. You just come here. You can be able to see all the alerts. The mother didn't have the companion, no oral fluids, and all that. So you can be able to key in your assessments. Fluids. Then the plan, you need to key in your plan. Then we have the actions here. In the action, we will have the continue with routine monitoring. This means that you maybe, for example, you were in you were on duty, and then maybe someone has come. You can continue with it. The labor care guide will not close, or maybe it's you continuing with it. You can be able to continue with that. Then we have the emergency cesarean. If maybe you are prescribed for the emergency cesarean, you can be able to click on that. We also have the referral, the birth, death, and also terminate ongoing progress. So for the continuing monitoring emergency CS referral, this will it means that the labor care guide will be open for you to be able to continue with the monitoring, even if it's a referral or it's an emergency. So for the birth, that means that the mother has given birth or she has delivered, so it closes the labor care guide also with death and also terminate ongoing progress. So that means it closes. So allow me to say birth. The mother's given birth. So here you have been given a consent for you to be able to action on that. So you need to acknowledge and proceed. Just a minute. So if you can be able to see here, we have all that we have keyed in, and also you can be able to see the birth. The mother has just given birth, and then it has closed the LCG. So here we have the summary for labor. So you just simply say add, and then you can be able to do the summary. So let's the duration, maybe it took 10 hours. It was delivered by Mark Elizabeth. What was the CADA? Then was the placenta complete? Let's say it was complete. The date of placenta expelled, it was today. The time it's today. Then placenta weight, the blood loss, maybe let's say it's 300. Then we have the uretonic if it was given, yes. Then perineum examination, it is intact. Laceration, episiotomy, it tears. If you say maybe it's episiotomy, then you can select if it was repaired or not. So just allow me to say it is intact. Then the condition of the baby, it's a live birth or fresh stillbirth, macerated. Then we have the sex of the baby, the birth weight for the baby is 3 kg, the birth length, we say 45, then the head circumference, the APGAR score at 1 minute, 5 minutes, I mean, let me catch this, maybe it is 10, and then the birth with the deformity. If the baby has a deformity, let's say if it's yes, then you can be able to key in. And if the deformity is not one of these which are being given here, you can say other and you can be able to specify the deformity. So then you save. So if you want to download or you want your LCG, you can be able to download, maybe it's a referral, there's some complication which has occurred, you can be able to download it and give it to the patient to go with it. Then after that, you have finished with the mother, you can now be able to fill in other forms where we have the cardex, nursing, the doctor's note, the fluid intake, the delivery form. So this delivery form is the same as the labor summary that you have seen there, but there are those cases that maybe you can get a mother as delivered before arrival, so you can be able to do the summary because the mother, you have not used the LCG for you to be able to use the summary, which is below the LCG. So after you have done all that, for the facility right now, the labor care guide has not been deployed. You can be able to do now the patograph. And also here, we have the treatment sheet. When you are giving the medication, these are the medication that have been prescribed and they're being dispensed. You can be able now to give the medication. So after the mother has given birth, we need to transfer this mother to postnatal ward. I will go straight to admission again. Then see my mother is being admitted here, still in the labor ward. Then I transfer this mother to postnatal. So here on the action, you can be able to see interward transfer, bed swap or discharge. I'm going to do interward transfer. I'm going to take the mother to postnatal ward. Then I can save. So from there, I can switch the ward. I'll go back to the ward. Then I search the ward. That is the postnatal. So you can be able to see that the mother is waiting for admission in the postnatal ward. For me to be able now to admit and give a bed, I'll just come to the actions and click on it and then come to admit. Then the major complaint, let's say it's post-delivery. Then key in the necessary things. paying its insurance. Then I give a bed. I select a bed for the mother. Then I admit. So then when I come to the admitted, I can be able to see the mother and take and start monitoring the mother in the ward. So I'll go to the inpatient again. So in the inpatient, I come to the inpatient details for me to be able to allocate the form for the postnatal, for me to be able to monitor the mother and the baby and do the examination. So I'll come to post-delivery form. Do the vitals for the mother. I say the temperature, just allow me to key them very fast. Condition of the mother, just allow me to key in. The funders still doesn't contracted it, placenta complete. The baby weight was 3,000. The membranes are complete. The blood loss was 300 ml. The perineum, it was normal. It is normal. Condition of the mother after delivery, she is still alive. Delivery complication, no any delivery complication, but if she has any complication, you can just say yes and then select any complication. And if there's no, the complication she's experiencing is not here, you just click on other and you can be able to key in the other complication. Delivery outcome, it's a single baby. The date of delivery, it's today. It was, yes, it's today. And then she delivered in the facility. It was conducted by this, you need to key in. Then you key in the baby details. So this is a male. Birth length, it's 45. Head circumference, 34. The head is normal. If you say abnormal, now you can be able to say what is the abnormality. So you do the mouth and gum. This is just a general physical examination for the baby. You do the eyes, the arms, the muscle tones, and this is being done within the 48 hours while the baby is in the baby and the mother is in the hospital. Then if it was a twin, you can be able to add and continue doing the examination for that baby. So then we have the impression here. It's spontaneous. Vertex delivery. If there are more than one impression, you can be able to do more than one impression. Then we have the post-delivery management. The baby was initiated in breastfeeding. If the infant correctly positioned, you say yes. If you say no, then is the infant well attached to the breast? Yes. Then we have the kangaroo mother care. Was resuscitation done? Was stimulation done? It's a yes and no answer. Just allow me to go very fast. Then was induction done? No. An artificial rupture of membrane? No. Was vitamin K given? Yes. TO given? Yes. Okay, was cancelled for feeding? Let's say yes. Then if you have any clinical notes, you can be able to write it there. Let's say mother and baby doing well. So if maybe there is any complication and maybe you need to refer this mother, you can be able to say the reason why you are referring and where you are referring this mother to. Then you give an appointment if there's an appointment that maybe you need to do. Then you save and close. Then afterwards, still in the ward, we have already seen all the other forms that you can be able to do. Now, maybe the mother is ready for discharge and the doctor is doing a ward round. You just come to the doctor's notes for you to be able to do your ward round. Is there any complaint? Let's say it's no. Any history, any HPI, no. Physical examination, there's nothing significant. Then system examination, the diagnosis. Then from there, you go to the plan and the management. If there is any medication that you have requested, you continuing with previous medication, change of medication or discontinue medication. Let's say this one is discontinuation medication because she is now going home. If there is any procedure you are ordering, you can be able to choose it from here and order any procedure. Then any therapy prescribed. Then the feeding orders, if there's any special feeding order that you want to do with this mother, any consultation with other specialists, there was none. Then are you transferring to another ward, referring to another ward or discharge home? We are discharging the mother home. Then we save and close. So because we have said this mother is going to be discharged, sorry for that. Then we can use the discharge form to be able to discharge the mother. It's here in patient discharge form. We key in the patient details. You can be able to see others have repopulated here. There is no complication. She has been cancelled on infant feeding. Was vitamin A given? The status for the baby on discharge, and if the mother's condition, she's stable. Then the patient outcome, the final diagnosis, you can be able to key in the discharge date is today. You give the clinical summary and the clinical notes, the discharge status, discharging home, and if there is any follow-up, you can be able to do the follow-up. Sorry for that. You can be able to do the follow-up for that mother. So again, now for this mother to be completely discharged, you will go again to the admission. Go to admitted. Then come to this action to say discharge. Give the discharge details. Let me see if this one will be able to save. Then the discharge, it's today. Then discharge status, you're discharging home. Discharging doctor. I may say it's Williams. And then we save. Okay, this was. Then after doing that, let me refresh because So you can be able to see that Evelyn is not here. So let's say she has moved to discharge in. So discharge in means that she has been discharged and she's still in the hospital. There are bills that she's supposed to pay, then to be completely now be discharged. So back to you, Frida.
Thanks, Evelyn. So we'll discuss the patient from the ward. So the patient needs to go and pay the bills. So we'll navigate to the accounting module to see how much the patient has accrued over time. So we'll just search for the patient from patient billing, not bills today, patient bills. Because remember, the patient may have been admitted in the facility for more than 3 days. So you go to patient billing and you search for Evelyn, but it's fine. You can just pick from patient bills today. Actually, no, Evelyn, just search for the patient from patient bill. Yes, so you'll search for your patient. So this is now at the inpatient billing. So you'll search for Evelyn, you select Evelyn. Okay, and then from here, remember, there are additional charges that the patient will be billed as they are in the facility. So we'll select add new bill item in your far right. Okay, and just make sure that the patient is checked in. So select current inpatient, current visit, and continue. Yes, so we'll add the nursing normally called the yes, the nurse yes, so there's normally the nursing fee that is charged to the patient, so you'll select that. And then you also normally so you select and then you say the payment method is insurance, or we can just select all of them. And then the next one you'll want to select is the daily bed charges. Evelyn, type
Just a minute. Just a minute.
Okay.
Frida, the nursing charges are not available.
It's fine. You selected nursing and nursing is the charges. I know there is a test instance, so we didn't configure properly.
Okay.
So the next one I want you to select is the daily bed charges.
Daily bed charges.
No, don't close. Just there. Yes. Apple too. Daily bed charges. Yes. So you'll select that. Okay, and then if any drug was given to the patient, also type it there, assuming we gave the patient paracetamol. But again, remember, paracetamol are ordered by the doctors, and the moment they're ordered and dispensed, the price will auto-populate here. All right, so, and then the patient was done for cesarean. Was it normal delivery or cesarean? So you'll also add that one.
It's normal delivery.
Yeah.
Normal delivery.
So you have to configure prices for all these things. And then we'll come here, and for nursing, we'll say the nursing charges fees are charged per day. Our patient has been in the ward for 1 day. So quantity remains 1 day. Payment method is insurance. So select and scroll down using your mouse. Just select payment method and scroll down using your mouse. Yes, so it's the first one, insurance. Okay. So you do that for all those items. But again, if the patient has been in the facility for more than 1 day, so you'll be able to specify the quantity. So you'll put either 2 days. So the quantity will be the number of days the patient has been in the facility. All right. So once you've done that, and then you proceed to save and close. So there is so much more. It depends on whatever the patient has done. So Evelyn, we checked our patient in today. So it cannot be 2 days, right?
True.
Okay.
So I can save.
Okay. Yes. So you save and close. So once you save and close, now we'll click on the where it's written charge items table. There is a hyperlink. Click on the charge items table. No. Just within the patient's profile, there's a hyperlink with the items: adult consultation, nursing, bed charges. The blue, whatever is in blue, click on it. Whatever is in blue is linked. Yes, click on it. So we have added the items. Now we want to go and process the payment. So when you open this page, you should be able to see the items that were done for the patient when they were in the ward. So you'll select all the items and then you're going to proceed and process the bill. So select all Evelyn on your left. Yes, click on the first box up there. Yes. And then we'll scroll to the right and then we click payments. We'll click payments.
Frida, I've already clicked.
Oh, I think it's my network. Then you'll select the payment mode. So the payment mode will be insurance. And then the amount will be the amount you can there on the screen. I don't think I can see any activity from your side. I don't know if it's from my side. Okay. Yes, baby. And then remember the share intervention is the intervention we selected when we were checking in. So when you click on it, it will bring her down wherever and you select it. And then you proceed to save and close. Now, Evelyn, don't type. If you select the down arrow, it should bring. Okay, that's it.
I rejected the bill line.
Yes, so as you can see, the insurance only paid 10,000, right?
Yes.
So that means at the facility level, the facility will have to co-pay. So the patient will have to pay 4,000 and the rest of the items, and then only the normal delivery will pay with insurance. So what you'll do is you select normal delivery, process the payment by insurance, and then come back and select the first 4 items and pay using mobile money or cash. So you're going to cancel that first. No, you're going to cancel whatever we're doing first. Maybe.
It is force.
So you'll select unselect everything. Evelyn, unselect everything and only select the last thing, vaginal delivery.
I just select the vaginal delivery alone.
Yes, so we first process vaginal delivery. The last item, select it. And then you come here and you say the payment mode is insurance. And then you put the amount, which is 10,000, and then you select the intervention. So you can save and close. Okay, and then you can just close that. And then you select the remaining 4 items. Select the remaining 4 items, and then you come and process the payment. And then you say now they're paying that using mobile money. So payment mode is mobile money. Amount is now the amount written there. Evelyn, it's 4161. And then the facility will provide the reference code, so you can put anything for now. And then proceed to save and close. We can close that as well. You can close that. So the other thing I wanted to show you is at the facility level, sometimes before the patient pays and the inpatient, they normally want invoice, right? So besides close bill, there's a print there. So you can always print, click on print, and be able to generate for them their invoice. So when you click print, you can get them their invoice before they pay. You can also be able to print for them their receipts and also bill statement. Right, so the invoice is, they can use that before they pay. And then also we have a receipt which will be available for after payment. Then the next thing you're going to do for this patient, because they paid for everything, you're going to close the bill. So you'll close the bill again. Close the bill is besides print. And then we'll put a reason. Patient discharge. Okay. So the moment you close the bill, now you're able to submit claims in the system. So you see the submit claim is now active. So click submit claim. So when you click submit claim, and then you'll click on the down arrow besides the name of the patient. And then now you'll be able to see the summary of the whatever was done to the patient, and the patient was in the inpatient. So the next thing that you need to do is you need to add doctors before you submit the claim. So on your far right, we have add doctor. Add doctor. So you're basically attaching the claim to the doctor, also to the patient. So in the doctor, so this will be the list of doctors who are at the facility level. So for this specific demo, we're going to search for a doctor called Barbara, because I think we already verified Barbara. Barbara.
Who spell the Barbara?
B. No, the second one. Sorry, the last one, the one with the KMPDC.
Okay.
Okay, and then we'll proceed to add doctor. So that claim will be attached to the doctor called Barbara. So at this point also, the doctor being added, and the doctor also the patient, even if it's a nurse, needs to have a valid license. And then now we'll proceed to click submit claim.
Just a minute, Frida. My battery is dying and I'm looking for a where to charge.
Okay.
Okay.
Okay, and then when you say submit claim, so it will also still show you the amount that is claimable from SHA. And then you proceed to say discharge reason. So we can say the patient recovered. And then you put the discharge dates and time. So assuming the patient is being discharged now, so the date and time remains, and then you continue to submit. Again, when you submit, you have to authenticate the patient. So you'll proceed to send them an OTP, but at the facility level now, we expect you to use biometrics. So you'll say use OTP. Then you send the OTP code. Evelyn will put the OTP code.
Oh. Frida, can you hear me? Frida?
Yes, Evelyn, I can hear you. Can you put the code?
No, it's like my nini has freezed my laptop.
Okay, maybe I can explain the remaining process. So once you put in the OTP code, then there's a message that will be sent to the patient that the visit has ended. And they'll be also shared the amount that SHA has been able to claim from them. Then from this point now, the facility will be able to see from the different tabs that are there. I don't know if you can see besides outside the OTP verification pop-up. There is the pending, there is the sent, pending, the submission, closed and paid. So for all claims that are sent successfully after the OTP has been entered from the patient side, they should be able to move to sent. So sent is the next step. And Evelyn, I don't know if you can zoom in or it's frozen completely.
It is frozen completely.
Okay.
I need to restart it again.
Okay, so there is the sent. So all the claims that have been submitted will move to sent. And then the ones that will need the submission from the payer will come to pending submission. The ones that have been closed because of various reasons, maybe it has been rejected, maybe the person who submitted the doctor is not verified, or the diagnosis is not a claimable diagnosis, it will move to closed. So you'll be able to see the reason and you can be able to resubmit. And then you'll also be able to see the list of claims that have been paid for your facility. Once you've done that, then you'll navigate back to the admissions, to the discharging now, where we have the patient, and you'll proceed now to remove patient from bed. We'll have there's another variable that now will be activated that will allow you to now unassign the patient bed. And then you can now be able to print the discharge summary and also the gate pass for the patient to now use that to leave the facility. So basically that's the workflow for the maternity in TaifaCare. I don't know if we have questions. But again, remember we are repeating this session on Monday from 9 a.m. And then also on Monday, we'll be having the Safaricom team joining so that they can take the technical teams through how to set up the biometrics. So we also advise you to reach out to your facilities to ensure they join the Monday meeting. So I don't see any hands up. I think I've responded to the questions on chat. So I'd like us to end at this point. I don't know if Ochemo is still on call. I can't see Ochemo. Evelyn, do you have any comments?
Yes, Frida?
Do you have any comments before we end the call?
No.
Okay, so I'd like to request us to end the call here. Thank you guys for making time. See you on Monday. Have a good weekend.